Color Commentary, providing you with experts, analysis, and background information on racism, discrimination, and inclusion.
Hello, everyone. I'm Karen Rosebaugh. In this second of a three-part series on culturally competent health care to people of color, we will continue the conversation with Taylor Linke, Assistant Director, Medicaid Eligibility, Washington State, and Dr. Jay Cook, Chief Medical Officer for Providence Hospital, Everett, Washington. But first, let's do a quick look back to the first of this series. The Washington State Department of Health cites 5 social determinants of health for the likelihood of a person living a long and healthy life. Personal economic stability, the community environment in which one lives, quality of local schools, access to a full spectrum of healthcare services, and the ability to both speak and understand English. The interview with Taylor Linke and Jay Cook continues with what Medicaid and Providence Hospital offer, respectively, in terms of access to a full spectrum of healthcare services. Ms. Linke.
The Medicaid Transformation demonstration has been a journey that we've been on for years and has been an effort to move towards integrated physical and behavioral health coverage. What we've done is we've consolidated across the state the behavioral health organizations along with the managed care organizations that provide the health care coverage to individuals so that it removes the administrative burden of having to, as a client, try and navigate between those different systems. We are learning from that journey, and the next steps of Medicaid transformation are being documented today and working with local health jurisdictions and the accountable communities of health to continue to find ways to streamline the process for the individuals to make it as easy as possible and to continue to look at holistic care. So looking beyond the physical health care to looking at the social determinants of health, right? I mean, there is plenty of research to prove that individuals' health is not only dictated by their physical health, it's heavily influenced by where they live, what they have access to, and a variety of other things. And so that's really what the demonstration is focused on.
Dr. Cook.
The mission of Providence Health System is to serve everyone in our community, but particularly and especially those who are poor and vulnerable, and many are vulnerable in those populations who have historically not been able to access the care and the services that they need. First is a communication admitting and acknowledging that those populations have historically not been well served, and to reach out to engage with individuals and groups to determine what the best way to serve them better is. We work through a group called the Providence Institute for Healthier Communities.
As we close today, let's look at the phrase equity for all in healthcare. To achieve actual equity, there must be an understanding of the societal determinants of health. Those determinants are data-driven. White Coats for Black Lives pointed out in their webinar given on June 6, 2020, that metrics or statistical data is important in healthcare. And I quote, "While racial segregation of medical care is illegal, health systems segregate patient care through several means. To correct this, hospitals must publicly release data on the racial demographics, primary language, and insurance status of patients. Publicly release data on the demographics of patients seen by providers of different training levels within the health system, and develop a clear action plan using metrics to address inequities in access to care by fully trained providers." End quote. Culturally competent health care to people of color is a must, not just during this COVID-19 crisis. Our guests today have been Taylor Linke, Assistant Director, Medicaid Eligibility, Washington State, and Community Support, and Dr. Jay Cook, Chief Medical Officer for Providence Hospital, Everett, Washington. This has been Color Commentary, produced in cooperation with Communities of Color Coalition. Send your comments or questions to colorcommentary@kser.org. Thank you for listening.